Hi, everyone. The idea with this is called Building Brain Awareness to help support brain injury recovery. And the idea is to get information from like what the outside world knows about brain injury. The information plus the discussion is very, very important. If there's like 1,000 topics that brain injury includes, I'm going to try to cover as many as I can. Probably can't cover everything, but there's a huge amount to discuss. So today, I am excited to do a panel discussion with several people who I consider experts with regard to the topic of how brain injury impacts mental health. I decided to do it with some slides, and so I'm going to have the slides to present, and then after that, we'll kind of like go back to just this discussion format. Give me a second, I'm going to share my screen, and I'll introduce our panelist as well. I'm going to introduce today's panelists. Chaandani Khan is a brain injury survivor and a founder of a business that helps clinicians integrate a patient-first approach to concussion treatment. Chandani, you still there?
I am
Hello?
definitely here with us today.
Thank you. And your company that you built is called Return to Life, and I think it's a really excellent idea, and I look forward to your opinion and your perspective both on the content and on how to help people understand these kinds of things.
Thank you. It's very exciting to be here and to join everyone.
I'm eager for this and excited about it as well. So thanks. Kathy McAfee is a
It's
licensed,
actually McAfee, Dan.
sorry, Kathy McAfee is a licensed clinical social worker with lived experience with cerebral palsy, and you have over 30 years experience working with many different clients, including those with brain injury. And the discussion with Kathy through email began the idea for this panel. So I want to thank Kathy for that. And in the discussion today, we're going to have two main topics. Kathy's going to start us off with topic number two. I just wanted to sort of put a pin in that right now. The next person is Cynthia Aguiar. She has lived experience with brain injury. She's a certified trauma-informed life coach, a speaker, a performance coach, and the host of a very good podcast called Moms with Concussions. I did Cynthia's podcast one time. She did my podcast. We had met at a conference. And Cynthia, are you there?
I'm here. Thank you
Great.
so much for having me, Dan.
I'm glad you are here, and I look forward to your input and ideas and discussion as well. And last one is TyAnne Crook. TyAnne, are you here?
I am
Yes.
here.
Sorry, we didn't
It's
get
good
to
to see
speak.
you in person again. It's been a little while.
Thank you very much. Yes, it is very good to speak, and I'm very glad to have you involved in this. So thank you very much. So TyAnne is a co-founder in the support group BrainStorm for Brain Injury, and you have a child who has a brain injury, and you're a caregiver, you're a mother to someone who has a brain injury, which I think must be extremely hard. As a brain injury survivor with two kids, I can only imagine what that other side is like. You also have an associate clinical mental health counseling degree, and you have great experience in neurorehabilitation for patients with spinal cord injury, brain injury, and other neurological conditions. And I'm really a fan of what Brainstorm for Brain Injury does, so I want to thank you for being here. And with that, recently a paper came out, Halibi et al. 2026, in the Journal of Neurotrauma about civilian trauma brain injury and its association with increased risk of PTSD, suicide, and other mental health diagnoses. I'm glad that this paper came out. We're not going to discuss this paper, but for anyone who needs evidence or evidence-based approach, the evidence is out there, and I think that everyone on this committee is very well aware of this problem. This paper just came out. It's very good for there to be evidence, but we're going to talk about it from much more, I think, personal and helping others experience. The two main topics are the ways that brain injury contributes to mental health problems. In some of the slides, I call it the brain injury impacts mental health. And then the ways that brain injury impacts mental health can be something a person is accurately aware of, awareness being the key word there. Being aware of the brain injury part is very important. Or the brain injury part can be something the individual needs help to identify and figure out. And for anyone who knows brain injury, that is a distinction that's really important. Topic one, what are the ways that brain injury impacts mental health problems? And certain brain injury symptoms appear like other mental health problems. And this includes bipolar disorder, issues like POTS, problems with attention, and there are many more examples. So I'm breaking this down into two categories, but really the main topic is what are your thoughts about how brain injury impacts mental health? And I could have put a lot more on the slides, but I decided to keep it simple. I mean, I did put a little bit more, but I decided to keep it simple because I think we can discuss this. So I'll stop sharing and we'll move to just discussion about this. So, what are ways that brain injury impacts mental health? And if any of the panelists or non-panelists wants to discuss first, anyone have any thoughts?
It's Julie, just one of the non-panelists. Sorry.
Hi. Yes.
I I just my biggest frustration, and I had my brain injury back in 2013, early 2014 is when I had my surgery to
Okay.
try to relieve some pressure in my brain. It seems like a lot of my physicians are not familiar with how to handle, or I talk about things and you can just see this glazed over look on their face, like they have no idea what I'm talking about. And
Yeah.
eh, I, I get misdiagnosed or not diagnosed with certain things all the time, and I'm constantly seeking after somebody that will assist with that. That's what I've found very frustrating. Not receiving help because people don't seem to understand the condition.
Tell me about it. I can say that in my experience, I ran into that for 3 years and I gave up because I thought, oh, they just don't get it. I'm on my own with this, which is not
Yes.
good advice. Or any of the other panelists have any thoughts? But yeah,
Well,
but
one of the thoughts that I have is that
please.
it's very difficult because brain injury affects every part of your life. So a question might be, in what ways doesn't it affect mental health?
Mhm.
You're dealing with so many different issues and symptoms and sensory issues and physical symptoms like vision problems and balance problems and coordination problems. And then you're dealing with symptoms that could be a direct result of brain injury, but they look like mental health issues. So it affects everything. And and it's difficult because I think when you have a brain injury, you first are trying to figure out what happened and you don't know because you can't trust your brain like you once could before the injury.
Mhm. That was really well said, Judith. And, something that stands out to me, as you mentioned, Dan, everything that I do in the space now is I provide patient-centered education
Yeah.
to clinicians who treat concussion and the brain injury and brain health population. Myself, I had a concussion 7 years ago. It ended up being a completely life-derailing experience as I had a lot of cognitive, physical, emotional, psychological symptoms. And it took me a long time to build my life back.
Yeah.
So having my own firsthand experience, followed by hearing from thousands of people at this point who have gone through something similar with crossover symptoms or crossover life impact, I really understand where we're all coming from in means of saying that, you go into any given clinician's office, and if they haven't lived the exact experience, it is really difficult for that person to understand where you're coming from and what your needs are above and beyond, very typically, the physical pieces.
Hmm.
That's what I find, and I think probably a lot of us will be having, nodding heads along here, just saying, yeah, there's a lot of focus on the physical and on, some of the pieces that are kind of I describe as the top line experience versus the life impact.
I like that layering because I sort of see it in that same way. Um, we still haven't given Julie any direct advice, and frankly, I don't know if there is, but maybe in a post hoc way, I would say, doctor, clinician, I think maybe you don't know enough about this, but it's not our
Correct.
job to educate them. And the other advice I've heard from people, which is better than what I did, is find a doctor that gets it, which is harder work. TyAnne, do you have any thoughts?
I will say one other thing. I like what Chaandani said, like with the layering, because additional elements are for everybody, all of us, brain injured, non-brain injured, doesn't matter um, what we see establishes certain expectations.
Mhm.
And that goes for everybody. So if I see somebody that's walking and talking and, out in the community and doing their thing, I have this expectation that they are going to act and function and live and perform like a non-brain injured person. And that's making a huge assumption. And, maybe you see someone walking with crutches and you automatically make assumptions of what their ability level is, or someone in a wheelchair, and you make these assumptions. And with brain injury, oftentimes people walk and talk and sound and look the same that they did before their injury. So the expectation is that they are going to function exactly the same. And that's great. If you've recovered really well, we have really minor deficiencies, fabulous. I am thrilled for you. That isn't always the case. And when someone else's expectation doesn't meet up with whatever level of performance, we have these disconnects, and we have a tendency to blame it on the person rather than get curious about like what the situation actually is. And instead we just make judgments, and that just piles more shame, more blame, more responsibility on someone that their brain is injured and they're already probably completely overloaded and feel like they're underwater.
Yeah,
That's such a great point. Just
Yeah.
having the onus on the patient, on the person who's recovering, on the survivor versus on perhaps the system or perhaps someone who's in a position medically who can help, whether it's medical, allied healthcare. That's a huge piece you hit on, Tyann.
Yeah. And can I
yeah.
add on to that, Dan?
Please,
Is this better, this microphone, by the way?
definitely.
Okay, perfect. Hi, everybody. And Julia, that's such a great question. I feel like that was very much my experience as well. It's, in terms of concussion support or teams, they're so wonderful, but it's often very compartmentalized. And so it's like, okay, we can help you with this specifically in this physical symptom, but it's how can we approach it with a holistic approach and a whole person approach. And often, I love what everyone's doing here because it is helpful for myself to learn about what was happening with my own body and to have a better understanding. And I would honestly say, and go as far as saying, from a trauma-informed perspective, the thing with a brain injury, besides, and Dan, I love, this is how we connected our first meeting was you said the biggest problem besides the injury itself is the misunderstanding.
Yeah,
And the misunderstanding itself is re-traumatizing. It's whether it's a small T or a big T trauma, we are re-experiencing trauma after trauma because it's misunderstood. We're being told that you're just depressed, you're fine, or well, you were totally fine yesterday, why aren't you okay today? And you're like, I actually don't know. And so we're waking up not only not knowing how we're going to feel, but not knowing who we're going to be that day. Am I
yeah,
going to be able to use the same language that I usually use, And I'm walking in a completely different person to my life today than I was yesterday, and I don't even have the capacity to explain why. And then, of course, so it is very difficult to go into these situations where doctors are so incredible, and there is still a lot of, I think it's actually why we're doing this. It's to continue the conversation. And I think that, Julie, the point you make is probably one of the most important points. And it's like, that's why this exists. And that's why finding your community of brain injury survivors is so important, because having somebody else just see you and go, yes, I experienced that too, that in itself is going to be healing and start to regulate your nervous system. Our nervous system really dislikes change and the unknown. And the only constant with a brain injury, I think, is the unknown. And so if we can continue to talk about it and just have these micro moments of I see you and I know how hard it is and I've experienced it too, that in itself I think is going to be one of the most helpful things. And the continued research, of course, and the conversations like these.
yeah.
Thank you.
Yeah.
Thank you, everyone. I think the conversations is essential, and also for them to understand that they may not know everything. I went to there was three conferences in DC, and I saw this campaigning for this advocacy for brain injured people to be the ones to connect to the outside resources, but I thought that puts the blame and the onus on us. And if I didn't have support from my mom during the early years of my brain injury, I couldn't do that. Plus, when you go, I got used to used to attempting to connect with a clinician, and then you see it in their eyes when they really don't know what you're talking about. And they're like, oh, not this again. And even though I had double vision, I could still read that in them. And that it continues to happen to this day. So I think that we have somebody said, maybe TyAnne, all the things on top of each other. Also, I guess everyone is saying the same thing. There's layering of problems, and you have to hold that and then still go out to connect with the outside world and get help. And it becomes very frustrating when that doesn't work.
it really shouldn't be in an ideal world the responsibility of the patient to educate providers, but unfortunately, we're going to have to do that because the providers sometimes don't know what they don't know.
Yes.
And you're absolutely right. You can read the expression on the face and you know they're not getting it. And I think if you're lucky, you find someone who will at least listen to you, but they don't always listen. So it would be helpful to
Mhm.
say to a provider, I have a brain injury. Can I please tell you about that? It's
Hmm.
important to me that you hear what I'm saying.
Yeah.
Mhm.
And it is out of our control for them to listen or not. Nancy, who is here, who had a brain injury since she was 3, she has taught me certain phrases to say. So I preload the phrase in
Mhm.
preparation for the situation, and sometimes they listen and sometimes they don't. Not to derail this conversation, but let's go back to the idea of the brain injury part impacting the mental health part and
Mhm.
that layering. That layering is let me ask this. Is everyone on the panel in agreement that there's that kind of relationship? Because to make that distinction for someone that
Mhm.
doesn't understand brain injury is even strange, but I think we're all on the same page with that. Does anyone have any thoughts on that layering?
Definitely do. Like that layering that I spoke about, I'm so glad it lands. And of course it would with anybody who has had the experience or who works very closely with people who have the experience. That's
Yeah.
something a tool that I use when I work with various clinicians, whether they're hands-on treatment providers, doctors, etc. It really just kind of helps to give some of our experience to someone in a way that they can do something with it, if that makes sense. And I acknowledge that, like, what we are all talking about, having the onus on you as a patient, I acknowledge that that does play a role in this as well. But I find it really helpful to explain, hey, it's not just these symptoms. And I'm very physical, say not just these symptoms. It's also my life is impacted in other ways.
Yeah.
And, need to acknowledge as well that depending on which provider you're seeing, which clinic that you're at, they're not necessarily there to hear your entire story, your entire experience. But if there are ways that you, like Dan was saying, if you can kind of preload, quote unquote, to borrow your words, if you can preload something that you know is going to help you to say at that appointment, that's a really good way you can prepare. For example, let's say you're going into a vision clinic and you arrive and they hand you pages and pages of paperwork. Maybe you can remind them, I have a brain injury. I'm having a hard time reading. I have double vision. Can you help me with this? Can you read it to me? As an example, this can be applied to a lot of different symptoms and challenges, but just that division of the two pieces, that layer, let's do that.
I
Yeah.
love that. Can I add to that?
Yeah. Yeah.
And I think that was you just described my experience. I remember going to physio for this first
Mhm.
time and I was wearing a hat and glasses and they gave me all this paperwork and I looked at it and I was like, I can't even write my name. I don't know how to read this. It was actually the
Yes.
moment I realized, it's not going to take the 2 weeks that Google told me it would take to heal from my brain injury.
Hmm.
But I think something else, and again, it depends on our own circumstances, and it's going to be so different and unique for every single person. But this is where we can call in family members or friends. We're so quick to ask for support if if we have a baby or something like that. So asking your family and friends, what do you notice in terms of my symptoms? Like, and my family, and I've got my mom here and my best friend here, but they would say, you don't speak the same, it's harder for you to do this. And they'd be able to write a list to also help me advocate for myself. And I often say, if you can find somebody to advocate for you at the beginning, send all of your friends information about brain injury, just to help yourself feel a little bit more supported. Again, we know that caregiving is a whole, there's a lot of exhaustion that comes with that. But if there are family members that can help write that list for you before going to see your medical professional, it might be a nice addition and take a little bit off of you if you do have that privilege of somebody being able to help you with that.
Yeah, I think that the outside world, even having one person help to some extent, and this kind of discussion can help them understand why they need to help us. In my
Hmm.
experience, I had a very strange, uh, I don't, I don't want to share, but My mom, I got home. I'm like, I'm not the same. I have double vision, derealization. I didn't realize the depersonalization. The mind was not my mind yet, but that took some time. And then my mom was like, he's a stranger. I shouldn't tell him. And I'm like, I'm a stranger. I don't know how to tell her. And then we started that discussion 18 years later after my podcast had begun,
Mm.
which that's like crazy because we couldn't communicate. We didn't know how to communicate about it.
Mhm.
And I know that a lot of the research shows that the people around the brain or people don't know how to help them. That's something
Mhm.
that comes up over and over in the data. I think that finding a way to listen to what is injured in them, and also, yes, Cynthia and I recorded about her problems, and she described the inability to do the paperwork, and it was, I'm trying to capture these glimpses of what we're dealing with, and that was a really good example that Chandani has laid out because that's just one of the many examples. It's not like once the paperwork is done, now I'm okay. It's everything
Mhm.
in life. And that also is how I think the brain injury problems are constant but changing, and then they impact mental health in so many ways. Do we want to talk about the different factors, or if anyone, I had listed it on the slide, and I can go back to it on my end, but it's like the depression, suicidality is a major problem. It's connected with brain injury, but I don't know if anyone wants to list or describe any of the mental health problems that come or they've seen from brain injury and also how to deal with it, how to get help for it. I guess that, yes, that is a question. So any thoughts on that? I have a whole list. I just need to find it. Depression, anxiety, isolation, suicide, suicidal ideation. I've discussed suicide with almost every brain injury person I've interviewed. PTSD from the brain injury, not from the accident, although that is the case. Hopelessness, extreme frustration, anger, grief, problems with sleep, the loss of self, which I think is a multi-layered brain injury problem. But that's just some of the thoughts that I had about the mental health problems that stem from the brain injury problems. Anyone have any comments on that? And also how to deal with it? How can someone improve? Please.
If I could jump in. So one of the things I will never forget, um, there was just as it from a caregiver perspective. I remember I go to a provider with my child and talking about some of the, I mean, it started off with some of the physical things that were going on post brain injury. I don't want to diminish those. I know this is a mental health discussion, but it turns into this discussion where this provider looked at me when I said, "Well, this is really affecting anxiety." And quite honestly, it was affecting anxiety for both of us. And I didn't even have a brain injury.
Yeah.
And the doctor looked at me and said, "Well, it's okay because it's all in your head."
Yeah. Yeah.
And I sat there for a second and I wasn't quite sure how to respond. And I remember leaving and getting in my car. And I think I had called my mom or my sister. I don't remember who it was now. And I was talking to them and I'm pretty sure it was my sister. And she said, "Of course it's all in your head. Your brain is in your head." And I was like, "Yeah, like why didn't I think to say that?" But the thing is like we don't appreciate all the things that our brains do for us because it comes so automatically. So then when a thing doesn't function the way it normally does, of course that's going to impact your mental health. Period. Like your frustration levels are just going to go up in addition to a myriad of other emotions. But in dealing with that, I do remember finally saying, like, here's the deal. This kid has a brain injury. I can't just tell him to turn off his anxiety. And like a lot of times with kids, they do like cognitive behavioral strategies. And I mean, like I would take it and I would try it, with my kiddo and sometimes things worked and most of the time they didn't. But I wanted to make sure I really gave it a try. And then I would go back to this provider and say, "I really need for you to understand his brain is not the same." I said, "I don't know all the ways, like I am still learning the ways that he is different and his emotions are different and the way he processes are different and the attention that he can have for something is different. And I'm still learning that." I said, "But I'm going to be honest with you. I tried this thing." I said, "Here are the things that worked and didn't." And because there were multiple times it was like, maybe you need to try harder. Maybe you need more structure. Maybe he's just really stubborn. And again, that
Uh,
expectation of I look at you and I expect you to perform the same way everyone else does, But here's the deal. They can't. So the reminder all the time. And again, the onus goes back on the survivor, which is like, okay, not that I'm not already burdened, but let me assume that additional burden so that I can continue to advocate for myself, right? The reminder of this is a brain injury. And guess what? Every single brain injury is going to be idiopathic by its nature. But of course, mental health is going to be a thing. It's always shocking to me when people are like, it's fine. Like you look fine. It's fine. It's no, no, I have a brain injury. That by its nature means my mental health is going to be different.
And sometimes I think you don't really know what to do about that difference. You know it's different, and you know that you don't function the way that you always did, and you want it to be different. So sometimes you try to push through, and that doesn't always work. It frequently doesn't work.
Yeah, it doesn't work.
May I jump in with a thought as well?
Please.
TyAnne, thank you so much for sharing, like just in such a genuine, honest, raw way of your experience. I just seeing various individuals on the call nodding along, and I just know I've heard this type of experience before, and it's all too common to hit that type of perhaps lack of support or lack of understanding. Um, one thing that stood out to me during my entire experience of the brain injury, my life derailment, my recovery, and then eventually rebuilding my life was that, in the first few years, I struggled with depression, I struggled with anxiety, I started having panic attacks, all of this for the first time in my life. I didn't understand it. I wasn't given like a guidebook upon injury that would explain these things to me. And what I kept on saying to various professionals and providers that I was working with on my recovery was, I don't know if I'm feeling these ways, like depression, anxiety, panic attacks, because I have literally been derailed from my life at a crucial point when I was, rising in my professional career, talking about getting married, wanting to have kids, wanting to travel, wanting to buy a house. I don't know if it's coming from that or the fact that my brain is injured. And we know there's a strong causation, correlation, relationships happening. And I kept on saying this for years and years. I'm like, it's coming from two sides here. And I think that that's, again, me and my layering, right? I think that that's really important for us to keep in mind that there can be so many factors that lead to someone feeling those types of ways, or even leading to the, much heavier side of things that Dan started talking about, whether it's suicidal ideation, and more.
Yeah, I think that the brain injury problems, which are very real and invisible, and I just want to comment about the if it's in your head comment that TyAnne made. I know many people who are like pick themselves up by their bootstraps and don't have a brain injury and don't know how to imagine a brain injury, and they say that it's in your head, and then my head was crushed, my body is fine. So yeah, it's in my head and it's in my brain, and it took me 7 years to very slowly rebuild a lot of what I lost. It was the craziest thing I've ever experienced. So yes, it's in my brain.
Mhm.
But people who dismiss it as it's in your head think that you can just power through it. You can't. You have to have the right supports, and it's a very specific process. Sorry, I got derailed from what you said, but the interconnectivity of the brain injury problems, I focus on the invisible problems, but there's a whole bunch of visible problems, which are the loss of what you were doing, the inabilities. All of our, people say don't put your like ego or like our value is what we do, but that's how our society is. That's how I am. That's how I've always been. That's how everyone I know is. And when you lose all that, it's really, really emotionally difficult. I have a, does anyone have something to say? Otherwise, I have a quote from one of my recent podcasts that touches on that exactly. But anyone else want to say anything about what?
I would love to add on
Yeah,
while you're finding that quote, Dan, if that's
yeah,
okay. And
yeah.
I think to add another layer to that, it's that when we do feel these experiences, because Shandani, am I saying your name right?
You're so close. It's Chaandani.
Shandani. Okay, I want
Yes,
to
and
make sure I was
ask as many
saying it
times
right.
as you like.
Chandani, beautiful,
Yeah.
thank you. I wanted to make sure to say it right. And I had a similar experience as you in terms of, kind of losing that identity, but the panic attacks that came after. And actually, it's how I discovered sort of EFT and led into the world that I'm working with now. But I think there's then an added layer of shame because then there are these behaviors or these experiences that we have, the panic attacks, the anxiety, the rage. And I'm going to say it here because I
Mhm.
find it very healing,
Mhm.
because there's so much shame that comes with it. But there was rage that I had experienced that I hadn't experienced before. I would yell at my kids. I just couldn't hear another word. And then the shame, the aftermath of the mental health, struggles that come with the brain injury. So then, on top of what we're experiencing and not necessarily having the understanding, there's the shame. And that adds a whole new level. And with the shame, then there'd be a symptom maybe flare up. And so it was kind of this vicious circle. And then on top of that, what I found was really, hindered sort of my recovery in terms of, let's say, mental health, was that the expectation is you have to go back to work. That's the priority, is getting back to work or getting back to school maybe for a student. And I used to
Mhm.
be a learning support teacher, a resource teacher. And so I remember creating these plans for students to get back to school. And it almost becomes the priority. What were you doing to be like a good person in your community? Like, what are you doing to provide in the world? But like, forget all the things that actually brought you joy. And we
Mhm.
let all of those things go, when really I would argue that those are one of the things that we should be, supporting our survivors with the most, is what brings you joy, and how can we make sure that that is as much as a priority and as much part of your plan as is going back to school or to work. And for me, I was a dancer. I was a professional dancer and I was a teacher. And the expectation was sort of like, well, you can't dance. And I had a dance company. We were, it was healing. That was my medicine. And
Mhm.
to then be told, we have to go back to work full time until then you can't dance. So I mean, that's going to severely affect your mental health. So I think it's creating moments of joy and allowing us to have these sparks or these moments of feeling a little bit like us. And often that
Mhm.
might be art or something that brings that person joy. And so I think the shame and is an added layer. And then how can we allow that person to re-experience joy in their own way and according to their new circumstances?
Mhm.
That's very important. Thank you for saying that. And you have brought up that it's almost like you're in a desert and there's these little oases or ways to in the moment at least deal with what's happening so that all the burden of the brain injury problems and the mental health aspects gets some relief and some
Yes.
Yeah.
maybe it's not, I don't know what to describe, but it's like a moment of, okay, I don't have to deal with all of it as intensely. And I did that too with exercise and with I used to sit when I had my brain injury. My parents, I was living with my parents. I went back to live with them, and this is in Southern California. And they had a nice pool and a jacuzzi, and I would sit in the jacuzzi because water on my body felt normal, felt like how it used to be before my brain injury. And I would do this mantra where I would say, "My mind is not my mind, and I need to get my mind back." But the moving in the water felt normal and felt like
Mhm.
almost like a salvation, but only in the moment. And also, I would do breath work. But I had alexithymia where I really didn't have access to these feelings, the shame, and remember flickers of rage and frustration. If like there's a normal scale of frustration, this frustration was as high as the ceiling. It was so frustrating, but with the basic things of what I couldn't do, and then somehow I just like stomached it and try again. It's
Mhm.
very frustrating. I want to read this quote from Mandy, who's a neurology nurse practitioner, and that's her profession before her brain injury. And the
Mhm.
discussion I recorded with her was really good because she has a lot of education about this, but she had said once she had her brain injury, it's like she didn't learn anything about the truth of it. But she said, and I had a provider that I went to at one point, not my neurologist, but I saw a provider in a TBI clinic nonetheless. She thought that my depression symptoms were my primary problem. So she just wanted to put me on a depression and antidepressant. I said, well, here's the problem with that. You can't medicate away my financial troubles. You can't medicate away the fact that
Mhm.
I'm not back to work. I said my symptoms were there before the depression, not the other way around. And
Yes.
I think the way she said it, I was like, okay, perfect. Like I remember that too, because once I did have access to the things, all the brain injury problems are at the core of it, and also the inability to function in your life is it's like overwhelming. It's like masking
Mhm.
everything. But I guess I don't know if there is a perfect solution. Like you go to a doctor and they want to deal with your depression, but finding a way to deal with the brain injury problems as well, is that is that the recommendation? Is that the best approach? I think it has to be, right? Because the brain injury problems need to be dealt with to deal with the mental health issues?
Well, you can only handle so much at one time. If you have a brain injury, you can only handle um, a little bit of information. Plus, I think sometimes it's got to be simplified because of processing speed problems and memory issues too.
Mm.
And so, if you don't deal with the brain injury first, you're not going to get anywhere.
Yes. You're not going to get anywhere. And something that Mandy and I had discussed in that sense is deal with the most pressing brain injury problems first. For me, it was the double vision. And for her, I can't remember what it was, but as she dealt with the layers of the brain injury problems, the other problems came out. And only once you deal with like what's most at the forefront, did the other problems find a way to be even presented, let alone managed. And it's, yeah,
Mhm.
it's a real process. I think that in a perfect world, if we could wave some weird magic wand and have the right supports for all the brain injury problems and the mental health issues at the
Mhm.
same time, but the brain injury stuff does need to be dealt with in layers and in ways that, quite frankly, I don't know if that is out there yet.
This whole thing about dealing with the brain injury stuff than dealing with the mental health stuff. The issue for both of those is life doesn't stop.
Yes.
Like it's nice to address the brain injury things, and absolutely that's necessary. Well, if I'm dealing with like my child actually did have some vision issues and dealing with that, well, guess what? He still has to go to school. He still has to play out on the playground at recess. He still has to do PE. He still has to interact with people in the community. And the brain injury thing is getting handled, I would guess, like I would say, like treated in some way, but the treatment is not keeping up with the things that are being thrown at you in real life in real time. And that just compounds the mental health part because it's like, I'm working hard. I'm really expending a lot of effort. I'm trying. Why isn't this working? Like, and the more I try, the more behind and underwater I feel. And so we can deal with the mental health part. And that was like, I'm actually working with someone right now that has debilitating anxiety, severe PTSD, and was making really, really good headway. And then had an issue with a car and then couldn't get to work and now can't pay rent and now can't, so like all of those things compound. So it's great to say, oh, yeah, I'm going to deal with this brain injury stuff. Oh, I'm going to deal with this mental health stuff. But life doesn't stop just because, oh, I need a second to get caught back up. Does that make sense?
There is no
Mhm.
second to get caught back up, and the treadmills of life continue. And then if you had the support for the brain injury issues across it, which means drastically reducing a lot of, I don't know, providing the right needs. I think that that is a, thank you for explaining that because it is in real life. We're not in isolation. Dennis first and then Jesse. Yes, Dennis.
I've had good luck. I'm only coming up on 2 years in, a pretty severe one. Um, but I have had good luck. I have a psychiatrist for meds, and we're working together to line that out. But I see a psychologist just for talk therapy every other week. Um, and that really helped. Even the frustration I have. And that's where my neurologist, I'm lucky. I know he's really good. Um, I was saying some word and to him, I was like, I'm experiencing this. And he said, oh, I said frustration. And he said irritability. And I said, that's the word. And so I'm lucky, I know, but having the psychiatrist for meds and the psychologist for talk has
Mhm.
really helped. So just want to throw that in.
Yeah, that extra support and discussion and someone to relate to. I remember the neuropsych they put me with. I wanted to kill that guy. I was like, he doesn't understand a thing. In my experience with brain injury, 17 years after my brain injury, I began to feel, and it was intense, like crazy. Like I never had, it was almost like all the emotions hit me at once. And I didn't know how to process it. It took 11 therapists to find a social worker who had been at the Mayo Clinic and had seen brain injury and believed me to find someone to connect with. And she doesn't have any training about this, but she's able to listen and she's like smart and wise. So, but I remember the other doctors, it was like a joke. They're all like, how, of course you have PTSD. Of course you have, I was like, what are you talking about? You're not listening to what I'm saying. So to have that person to connect with is essential. Thanks for that. Thanks for sharing that because I think that's good advice and it's hard to find that person. Jesse?
Yeah, I just it's so lovely to be a part of this call with the fellow survivors that are using our lived experience to help others. And I just wanted to add how, in my experience, I'm in Vancouver, and the rehab center here recommended that I take up mindfulness, and it was like 80% really helpful. It was so wonderful to meet my symptoms with more grace and find some quiet. And but about a 20% of it, I'm making up the percentages, but was a total disaster and led to very serious mental health concerns around panic attacks and dissociation, and then shame, because I was like, well, those other students, the regular folks that didn't have a brain injury seem to be doing this fine. Thankfully, in my case, I'm an educator, and so I just kind of defied the teacher, and I built my own practice in taking from what was working and what wasn't working, and I found it was so helpful that I wanted to share it with others. So I became a qualified mindfulness teacher, and now I'm writing a book about it. It's coming out next June, The Power and Perils of Mindfulness for Brain Injury. It's a really beautiful journey, but I wanted to bring that into the conversation, that sometimes it's
Yeah.
not just our symptoms, but it's actually the help that we are given that can cause that kind of pain. Or sometimes people are recommended to push really hard, the kind of run towards the danger type of practices that can lead to a lot of shame as well if it backfires. Maybe it works for some, but for some of us it doesn't. So I just wanted to kind of add that piece to the puzzle. Thank you.
Can I add to that, Dan?
Yeah,
Hi
yeah.
Jesse, can I mention that? Because thank you so much for sharing. I connect a lot with everything you said as a former educator. I'm also in Canada, I'm in London, Ontario, um, and everything you said. And that was my experience too. And I again, this is coming in with a trauma informed lens. It's like we can talk about the event or what we're experiencing, but if we're going in the eye of it, we may be re-traumatizing the body. And so I love that you were able to use a differentiated approach with yourself, and you had that knowledge. And I think it's really important, as educators, we always talk about differentiation, and that, I mean, has never been more important than I would say with the brain injury, because it is so different for every single person, based on your physiology. Even the neck injury, we know that that's something women and men present differently. There's not a lot of research for, like, there's so much to consider as well. But that's actually the reason that I went into EFT tapping, because we'll use an indirect approach. And it's something that we talk a lot about, is that we don't actually have to go right in the eye. We can do it safely. And I think it's so important to be so gentle with our body and tread lightly when we're trying new things with brain injuries, because it is so complex, and like we've spoken about it, it's so layered. So treading lightly, and definitely finding somebody who's going to support what feels sort of aligned for you in that moment. So I love that you were able to do that, and I love that you're writing a book, and hope that yeah, well, I'm excited for that to come out as well. Yeah.
Hey,
I'd like to add on. Oh, sorry.
oh no, I
I,
would
I
just very
love.
quickly to say that I wanted to say before, and I forgot, just very quickly to say that sometimes survivors get a lot of help for their brain injury, but they don't get help for the trauma piece. And so many of us are also trauma survivors from what caused our brain injury, or there's a lot of evidence that those of us who go on to have prolonged symptoms had previous trauma as well. And so I have found it, and I talk about it in the book, the importance of adding trauma therapy at the same time, because they're not the same. They don't necessarily need the same remedy, right? And so it's been very powerful to do somatic experience therapy, EMDR, ketamine assisted therapy, all different ones have been helpful. So I just wanted to throw that in the mix as well.
Uh, Great point because they do need different supports. As my double vision and my cognitive therapy needed very different help. And then the alexithymia that came out much later, which is an ability to even get at the feelings, was completely different. And I imagine that's the case for every levels of dealing with the trauma. And for the sake of time, I wanted to jump into the topic number two, but I have to ask this. I have had many questions from people about why would mindfulness be harmful because people don't understand why that is the case. And I absolutely think it is, it can be the case with brain injury. And when it is harmful and leads to the pain that comes from all this, I don't think the unbrain injured world understands why mindfulness leads to that, but that's come up in a lot of discussions and in my experience too.
So I guess it's chapter 2 of the book.
Okay,
There's a
so
whole
sorry, the
chapter
book.
on it.
Yeah.
It's coming out in June 2027, so it's a little while. But
Okay.
I did hand in my manuscript April 1st, but it's a lot of editing. But I could just say briefly, and I'm sure other people may have some reflections too. But since I brought the topic up, the one of the things that I have tried to explain, especially to meditation teachers
Yeah.
who don't understand the state that we arrive in the classroom. So
Mm.
brain injury causes our sensory world, the outside, lights and noises, many of you know, but also our internal signals become very loud um, as a part of many people's experience. And so we also become much more easily dysregulated. So our symptoms seem like a threat, even though they're not. And so we end up going into kind of fight, flight, and freeze response really quickly, even though it's just a headache. And so this is kind of the
Right.
core of the message, is to say we're arriving with a body that's very speaking very loudly to us. Whereas for many people in society, their bodies are so shut down, they're not listening to their bodies. So they need mindfulness to go, oh, I need to listen. What's my body saying? It's hungry, it's tired, it's and for us, suddenly it's all very loud. And so when the teacher says, let's pay attention to your experience for 45 minutes, and I'm like, it's already very present for me. I don't need to
A
pay
bunch
attention
of
to
bells
it.
ringing in my head. Yeah.
Yeah, so
Um,
that was just a brief kind of answer around the fact that we are physiologically experiencing the world in a very different way.
Thank you for that answer. And I want to share something about I've been recording the brain injured part of different brain injured persons' experiences are very, very different. So I didn't have that, but I used mindfulness to approach my cognitive inabilities, and I had to focus on it in a way that I had to make up to make sense of my cognitive issues to then even make sense of it to then I don't know improve it. But I didn't have the body stuff, but I know other people do, and I think for each brain injury person, the brain injury part is different, but it's still brain injury, so it has certain symptomology, certain similarities, but they're uniquely different, and that's part of what makes this so difficult. So I'm just going to jump ahead to topic number two. Kathy and I had begun this discussion about this, but I'm just going to read it. The ways the brain injury impacts mental health can be something a person is accurately aware of, or the brain injury part can be something that the individual needs help to identify and to figure out because it's very hard to make sense of it. And I've spoken to over a dozen people now who had a brain injury, head injury, and they didn't realize, especially in the older days, brain injury wasn't labeled, so then they just lived, it's just they continued on and didn't have any way to make sense of that. And the problems were there in retrospect. So, Kathy, if you want to start, the idea is how to help people figure out the brain injury part and also how to help the clinicians and the support and the help and the doctors and those that are supposed to help us. How do we get them to understand that?
Yeah, I think for the patient, I think when you have something like a brain injury, you need to, if you don't have any providers yet, because some people just have a new brain injury and they're just starting this journey, you need to connect with your primary care doctor if you don't have any providers, and then hopefully they can refer you to other providers that can help because you're going to need a great deal of help. I don't know of anybody who has had a brain injury unless that brain injury is very mild, and they may be a different subset. But if your brain injury is not incredibly mild, you're going to need a lot of help. And I think the first thing is to reach out to your primary care, let them know what's going on, see if they know physiatrists, see if they know any other kinds of therapists that may help, like occupational therapists, cognitive therapists, physical therapists, whatever you may need. And just recognize that you need help and give yourself a lot of time to undertake this journey because it's going to take a lot longer than you think. Also, use any kind of help you can from family or friends because even if they don't know how to help, if they care about you, that matters. It matters a great deal, even if they make mistakes. If they're trying to support you, allow them to do that. So those are probably the best things I can think of if you're the patient. And if you're a clinician, um, I think you need to be aware that there's a great deal to know about this, and most of us are not well trained. I come from the social work field. I'm a licensed clinical social worker, and I can tell you that in graduate training, they didn't train at all, not at all. Everything I know about brain injury, I know from people that I know from my own experience. I don't have TBI. I do have cerebral palsy, which is very different, but it's still a brain injury, and I still have to deal with some issues that are similar, like fatigue and pain and shame and all of that as well, although it's different in my case. I had to start to see if I could educate myself. And if you don't know anything about brain injury, you start by listening to the client. If you know people, other clinicians that do know about brain injury, let them teach you. Study on your own when you can. Reach out for everything you can. Use family and friends because they may not be clinicians, but they can offer a great deal of insight into what this person is like now and before the brain injury.
That's really good advice. And going back to the very first question that came up, when the doctor, I guess, or the family member doesn't know how to listen, try to find somebody else who can be curious and can be non-judgmental. And that's actually hard to find, but maybe with all the work we're doing, that population will grow and they will recognize that they don't know and that we need help. So yeah, that's really good advice. And then yeah, it's a journey and it's a crazy process. And I just want to say something about the mild, moderate, severe. It's a nomenclature, but really there's a depth to brain injury that can get worse and worse. And if you have a brain injured part, that part can get aggravated and get worse on its own. So even a concussion can turn into a post-concussion syndrome and become a lot worse if you had a hit to the head that isn't taken care of. Wendy, you have a question or comment?
I just had a question because, like I said, I've had 10 concussions over my lifetime, and a couple of them were pretty severe. But because I'm normal, quote unquote, I'm just now talking to my primary provider about getting a referral and having my last one been like 2 years ago. I don't have anything. I mean, I have multiple things, but what would be the key words, key phrases, key areas to help them to, you know, get my insurance to cover me getting this referral to see a neurologist? And, is there a specific area of neurology? Like at one point, I was diagnosed with idiopathic hypersomnia with borderline narcolepsy. And in the beginning of this, sorry, I'm gonna get emotional. I got really emotional because I started like my thinking back of all these different things in my whole life that happened. And I was like, oh my God, it could have started from that first one. Like these things could have been my whole life. And I always just thought, oh, that's just a thing. You just have this. That's what's wrong with you and all that stuff. And I always overcompensate. Anyway, that's my question is, how do I move forward? How do I get to somebody?
Hi, Wendy. I'll just jump in here and just wanted to say thank you so much for sharing as well. I fully understand where you're coming from in the sense that it can bring up emotions, and I'm so sorry to hear of your life experiences. Um, if I understood you correctly, you've had a history of about 10 concussions. Is that right? Okay, so the reason that I wanted to jump in with what you shared and just offer a suggestion is, to be clear, I'm not a medical doctor. I don't come from a medical background, but I definitely am very ingrained in the concussion space and specifically with clinicians who treat this population. What I strongly suggest is, number one, if it feels right for you to seek help through a medical doctor and neurologist, absolutely continue as planned. What I highly suggest either adding on to that, or for some people, starting with is actually finding a physiotherapist who specializes in concussion. They must specialize in concussion. And what I mean by that is that this is someone who works at either a concussion clinic specifically, or it's a physiotherapist who has specifically worked with a high volume of concussion cases. So they have that street cred. They've seen a lot, they've heard a lot. The reason that I suggest this so strongly, just from what I know in the field, is that physiotherapists who have that specialty, they generally have an above average knowledge of other issues that they can flag for you. When you're speaking with them, they might be able to flag something, another concern they think you might be having. They also might be able to refer out to different professionals. And so that's a recommendation that I will consistently make. And again, it's not to replace medical direction you're going in, it's just another idea of what to bring in. They could be a great starting place. Also, just wanted to say that, I'm sending you my absolute best. My heart is sending your heart a big hug, and this could be a really great journey that you're embarking on overall.
Thank you. Yeah, no, I appreciate that. I started with some EMD therapy a couple of last year, and it has been so amazing. And she's been amazing, and it's been super helpful. But then I'm also like, I'm hitting in this area where I'm finally going, okay, something's just not right. I can see the word and I can't say it, or I have blackouts of time where I don't even remember. Like my son's like, well, you taught me that. How do you don't remember? I'm like, it's gone. Like the memory's just gone. And now I'm hitting perimenopause. So I'm just an emotional basket case.
Mhm.
So I'm like, I don't know where all these things go. And I know, the men here may not understand that. And maybe some of the younger women won't either. But, it's a real challenge to go, is this grief from loss? Is this perimenopause issues? Or is this my brain? Or is it all of the above? And I'm just like, having a difficult time being myself. Like,
Mhm.
I don't know, like even the things that made me happy to do those things, I have no desire to try to do those things. So thank you so much I'm gonna look into that some more. So
Y-
I'm
May
just
I
so glad
also?
I've had this little brain sitting on my desk for probably 3 years, and I finally looked at it and went, I'm gonna look up this site. So
It's a
With
process to
with
find that right help, but I agree with what was said in terms of if it's a layering, you need to find someone that can help you with the most top
Mhm.
most layers, and maybe they'll address a vision problem or some other problems, and then it leads to this cascade of figuring it out. And also, I can share that it took me a year to figure out what my problems were. I just like sat, I was like, what has happened to me? And so what you just explained is a really great example of that. It's like what has happened. I think many people have mentioned that here. Sorry, did I cut someone off?
I was just going to add one piece
Yeah.
about perimenopause, Wendy, and for everyone who's attending and listening, there finally we're having a lot more conversations and research around women with concussion and perimenopause. That has been a topic that has just previously not received much airtime or attention, in other words. That more and more conversations are happening, and I just wanted to share with you and everyone else that, hang in there. There are so many women who are in the same boat, and I mean that in a really validating way. Wendy, I'm going to think if you want to find me on LinkedIn or perhaps and Daniel can connect us. There's someone in my network who you might be able to speak with, and I'm just sharing that now so we don't forget.
Thank you both. Are there any closing thoughts? Because we have been here for over an hour and this has been both excellent and also intense.
Yeah, I mean, I think these conversations are just so important and they are really intense and they can bring up a lot of emotion and even I feel it, right, bubbling because if you know, you know.
Yeah.
And but I think that it's just so important and to continue to have these conversations around brain injuries and how they present themselves. And I think I saw something in the chat writing that, finding the beauty in it sometimes and it's not at all, taking away the pain, but trusting that there could be some, whether it's meeting somebody new, whether it's learning more about yourself, or the fact that what, we can't ignore our body anymore, right? Maybe before we could, but if I don't sleep well, my body, I can't force my body or push through anymore. And sometimes I see that a bit of as a gift. I have a direct line to my body, and it's always telling me how I feel. And so, it's finding communities where we're given grace and can honor that, and that can be a beautiful thing. So I think just hearing this here is healing, and it helps us regulate our nervous system in a sense. And yeah, so thank you, Daniel, for creating the space, and it's such an honor to speak amongst you guys. And of course, I'm sure everyone will have our information, so I'd love to connect with anyone after this as well if they'd like to.
I'm sorry, my vision is really bad, so I'm unable to see how to type in the notes like to all of you. So I apologize. I have to verbalize it. How do we get these notes that I've been seeing pop up and or the notes from this particular um, discussion, because they're so helpful. All the information you guys have provided, I'm like overwhelmed. I'm like almost in tears because oh my gosh.
Oh, yeah, me too. Okay, so the notes, the chat has been going off. I stopped monitoring it because I can't do both. And so I can send the chat to everyone who was in the who's registered for this, or I can do other things if tell me what you would like, or I can email it directly to you. Um, but yeah, normally I just put the video out on the talk series. It's a YouTube channel, and it takes me a little bit of time to do that. The panelists who are involved, I put their websites because I think you just click on that and contact them, and they will be more than happy to help. But beyond that, yeah, I don't know what to do beyond that. If you have any requests, please let me know, or I can also literally send you the unedited Zoom recording right when Zoom gives me this, which takes a few hours. So,
Are your slides going to be part of the YouTube? Will I be able to see your slides and notes? I guess that's what
oh, I can
I
put my
should
slides.
ask.
Yeah, I can. I usually send my slides. It's funny because I literally generated those slides in like a few minutes last night. So, yes, I can share those slides as well with everyone who's registered. How about I'll do that? I'll send the slides and the chat because I don't know what's in the chat, but I think it's probably helpful. So I'll send that to everyone who registered. I have my email on what I put on YouTube, so anyone can contact me for it. But I'll do that. I'll send the slides and the chat to everyone who registered. Okay.
Thank you, Daniel. I
All
really
Thank
right. Thank
you.
you,
appreciate being
Kathy.
part of this.
Any other thoughts before we end this? Anyone want to say anything?
Yeah, we need to do more of this.
I'm glad you said that because I have thought to in the past, and it's been about 4 years. I'm like interview brain injury people about what they're dealing with, talk to the outside world, and the space that I'm in is sort of in between what the outside world knows and what the brain injury people know. But this kind of format actually might be better. So maybe next year I'll completely shift and do a lot more subtopics like this. That would actually be easier and really I think really informative. Um I'm trying to almost jump ahead of the research because as the research comes out, it takes research is very hard to do and to get anything and then to publish. So this kind of is like a leapfrogging of that. Okay, I'm gonna end it. Thank you all for being a part of this. It was really, really informative. Thank you, panelists, for being involved, and thank you everyone else for being here. Okay, bye everyone.